So the decision between TAVI and surgery is really a heart team decision, but it used to be patients over 80 would get TAVI and younger would get surgery, and now that number is lower and lower, such that in the guidelines now it's even 65. It has everything to do with patients' comorbidities and then also their anatomy, which is based on the CT scan, whether they're anatomically suitable for TAVI. And then in addition, patient preferences are extremely important. In the end, by having a heart team approach where cardiologists and surgeons see the patients and make decisions together, just leads to the best result for the patient.
There's just some patients that open heart surgery is going to be an extremely challenging recovery. So having the accessibility to a procedure like a TAVI, which is catheter-based, minimally invasive, is a one-day stay in hospital for probably 90% of our patients, is quite attractive, really. Hopefully when I get to that age, then that will still be an option for me if I ever needed something like that. So I think, again, being specialized in this, there's not a lot of centers that have this sort of program. So to have this and, to make patients, to be able to offer this to patients is quite a special thing.
So patients are often very nervous about having their TAVI procedure, but when they realize that it's done under conscious sedation, they're made very comfortable, local anesthetic only, and that the recovery is quick such that they could go home the same day or the next day with very low risk, then they feel quite comfortable. It's such a common procedure now that they probably have friends or relatives who've gone through it. And so I think that word of mouth aspect has made people realize TAVI is much more like PCI than it is like surgery. I basically tell them it's like just putting a big stent in their heart that has a valve in it. It takes about an hour, and the recovery is a day or two in the hospital.
Yeah, so when our patients are reviewed in rounds and approved for a TAVI procedure, then I would be giving them a telephone call. I would, ask them and discuss a procedure date with them. We're very lucky in the fact that I can book a patient within probably 2 to 3 weeks after the decision's made to approve them for the procedure. So then I would provide them instructions in regards to medications and, when they have to be here for their procedure on that day, where they need to go, what their expected recovery time is. If there's any additional nights in hospital that we may be thinking they might need, I try to let them know ahead of time so they can arrange, their transportation if they need to. They also are required to have an appointment with our pre-admission clinic, which is our anesthesia clinic. So I book that on a day prior to the procedure, which again, they meet with our anesthesia service, nurses, the pharmacist, and go through just their preparation for the procedure again. After TAVI, the recovery is actually, I would consider it somewhat minimal to a number of procedures. Many of these patients have had something, such as an angiogram, so they're quite familiar with some of the recovery because the medication you get during the procedure is very similar. I would say the main thing I sort of focus on with the patients in their recovery is that most of them are worried about their activity level, how much care they need from others or their family members afterwards. We do ask that they have someone available who either lives with them or can check on them frequently for, at least the first 24, 48 hours afterwards. We also ask them to limit how much they're allowed to lift. So that's anywhere under 10 pounds for the first 1 to 2 weeks, and then they can start sort of getting back into their daily routine. There is no driving, unfortunately, for a couple weeks after the procedure, and then they get cleared through their family doctor to get back to driving. And that's just to limit the pressure on the puncture site or the access site, as we call it, in order to let that heal. But really, the recovery is just, it's not a typical cardiac procedure where you've had an open heart surgery where you're laid up for weeks on end. You can get back to doing your routine within 2 to 4 weeks after this procedure.